Thank you so much. I have one of my teenage son's friends has been diagnosed with Barlow syndrome, and they say because he is so tall, that's a contributing factor, and then also blood clots are a concern. So I just wanted to know, from what you've said tonight, I would be suggesting the Calmag or the magnesium just to ease that, or to aid with the regular heartbeat.
Yeah, yeah, there are a number of syndromes. Marfan's is another that happens in very tall people. And yes, they do have issues like heartbeat irregularities and everything, all of the minerals. So I really would look at multi-mineral alfalfa. I would make sure that there's enough magnesium as well with either the Calmag or the magnesium on its own. But the multi-mineral contains such a wide range of minerals that are essential for the electrolytes that make it easy for the heart to beat strongly. But, to go back to what I was saying right at the very beginning of it's important for your general good health, a very tall guy like that, and probably very rapidly growing, needs the protein to be able to make all of the tissue as strong as possible, not just the muscle, but all of the tissue. So all of those various layers in that artery that I showed you, makes a difference. If they're strong, they're much less likely to be damaged. I hope that helps.
Thank you so much. Thank you.
Thanks, Barry. Are there any other questions? You did a good job, Barry. You answered everybody's questions, but that was really great. Thank you. Okay, guys, are you all done? No more questions.
No.
Barry, that was...
May I ask another question?
Yeah.
So another friend had a heart attack, and Dr. Barry was saying the flavonoids assist with the heart damage post the heart attack. And then also, I just wanted to know, I suggested the Omega post that heart attack.
Yes.
Okay.
Yeah, I mean, the anomaly is, well, it's not that. It's much better to have the flavonoid or the Omega on board before the insult. Okay. You are less. It helps to reduce the area of damage if you are already on the Omega or the flavonoid before a heart attack or a stroke, for that matter. So, if you're looking at cardiovascular disease, strokes are part of the system. I would certainly look at using Omega post-stroke, post-heart attack, all of those things. I would just delay it until the guy is out of hospital.
Thank you.
That's wonderful. I see there's a message from probably a guest saying, Mamo says, what kind of protein?
Okay. I guess I've assumed too much. We're talking about near life, and really I am convinced after 30 odd years of using the product, but also comparing it with others, that we really do have some amazingly effective products. So I would look at the NutriShake, the NeoLife Shake, or the Sports Shake. I don't mind which one you use, because the protein is all of those contain all of the 22 amino acids, which are vital for the normal growth of all of the tissue. So yes, that's what I would look at.
That's good. That's fantastic, Barry. Celeste says, what do you recommend for someone battling with heart disease and post-heart attack? I know you've covered a lot of that.
Yeah, I mean, it is a lot of those things. One thing I didn't speak about was vitamin E, specifically because often with a heart attack, the heart is not pumping as efficiently as it should. And so with vitamin E, it does help to extract more oxygen out of the blood that the heart is pumping. So if the person is in some degree of failure because the muscle of the heart is not doing its job, then that's worth thinking about as well.
Would you recommend lipotropic as well?
Oh, I have it here. Yeah, totally. I don't know. I laughed when I saw this when it first was presented, because it's got that lovely, deep red color. And it just reminded me of LDC. And LDC is such a good solvent of fats that I thought, well, that's exactly what the lipotropic is. It's a very good solvent of fats, but it's from inside. And so I would, yes, lipotropic is definitely one of the cardiovascular supplements that make a real difference.
And another question, does CoQ10 make a difference to heart disease?
Totally. It would make it, if you have a damaged muscle, the CoQ10 would help it to repair, and it would help it to be more efficient. So whatever muscle is there is better and working better. So yes, CoQ10 I have as well. I mean, yeah, sorry, it's just time was going.
That's super. Barry, another question. Can you explain the link between long COVID and the heart?
Yeah, I mean, when they first started working out what COVID was doing to people, right in not long COVID, but short COVID, if you can put it that way, it was clotting, inflammation, and oxidation. And omega and carotenoids are just targeted at that. It really is. And so long COVID, in my mind, is really like a chronic fatigue syndrome. So you want to reduce the oxidation, you want to reduce the inflammation, and you want to make sure that particularly you're getting a lot of the minerals. So I would go with the Pro Vitality. I would aim for more of the carotenoids and the omegas on a daily basis. And I would definitely look at multi-mineral alfalfa. To take that, yeah.
That's wonderful. Okay, well, I think that's everything. Is anybody else wanting to say anything?
Make a difference, and yeah.
Okay, and Barry, so quantities, I know people will be looking at quantities of omega, etc. I know the bottle says 1 to 3. So if you you take 1. If you're not well, and we're talking about heart, then you take 3 or more. Is that right?
Absolutely. I mean, we haven't even talked about blood pressure, which is another of the silent killers, very much like diabetes. You need to be taking more to protect yourself, because just like with a high cholesterol, if you are attacking the problem with omega and carotenoids, you're attacking the problem from 3 different areas. You're attacking the oxidation of LDLs, you're attacking from the anti-inflammation of the lining of the arteries, you're attacking from the increase in HDL, and you're attacking the clotting that occurs that you don't want to happen. And you just need to be getting those on board. So yes, I would definitely be looking at the 3 at least, and if you have an issue, a problem.
Yeah. That's great. Well, I think we've covered everybody's questions, and you've certainly done a great job in under an hour, Barry, with all the questions. I think you're marvelous. You're really fabulous. We look forward to seeing you online next month.
Yeah. Okay.
And I just want to thank you so much from all of us online. Just say a very, very big thank you for your time, your help, your advice, and there are a lot of thank yous coming through here for you. So there's one more thing. I know someone who is on products, but his heartbeat has not been more than 45. Well,
okay.
We don't know what product he's been on. But I don't know, maybe.
Yeah, but our products aim to get the health of the heart to its optimum in whatever situation it happens to be. If it's already in a situation where the heartbeat is too low, I mean, I'd love to have a heart rate of 45. As long as I was able to get up and do all the things that I wanted to do. But if my heart rate was 45 and I kept on fainting, then I would have a problem. But then you've got to find out what the problem is. And, there may be a need for drugs at that point, or a pacemaker or something like that. But the thing about nutrition is that you can use that without any negative effect from it. It would only be a positive effect. And so that's what you're trying to do. You're trying to get it working correctly.